Hello. Good night. Hello, everybody. I'm coming to you. Dad, shush. What? Shush. Let's start again. Dad, I'm live.
Oh, sorry.
We are coming to you from a new location. This is one of my several desk offices. This is my standing desk. Because I've been researching and having some wine from my Cho cup. Hello. I'm going to pull up, bear with me because I'm going to pull up on this screen the Fartyfacts Facebook Live, and hopefully with no sound so I can actually see the comments without tapping the iPad all the time. Hey, Randall. Hi, Dad. Oh, what's with that? He's saying goodnight to the kids. He never does that. He's getting in everyone's business. Okay, Dad? Go to bed. It's 8:04. It's past your bedtime. Love this art. Yes, this is from a guy off the beach in Byron Bay. And that's red, white. Yeah, it's nice, isn't it? Okay. So, a couple of things on tonight's agenda. Okay, the Oz-sponsored Oxford vaccine. What's that all about? I just heard on the news that a man in South Korea who had recovered from COVID-19 was in South Korea. He traveled to Europe and he was reinfected with a different strain of coronavirus. How they knew that info about the different strains, I don't know yet, but I'll keep us posted on that and hopefully unravel that package a little bit more, because until now we've had no evidence of anyone having proven that a reinfection had been from a new incidence of disease. So I'll keep on top of that. I just found out, so I don't know quite yet what it's all about. The other thing is the Victorian extension of the state of emergency powers. Who cares? Why do you care that everyone is going to stay safe by having these powers extended 12 months to have 4 weeks at a time per block to look after the health of Victoria? If you think that your civil liberties and your freedom to choice is being compromised, maybe it's time to move states or just come over here and live in reality with everyone else, where everyone else cares about each other. If you are coming across someone in your world who is upset that their freedoms of choice have been taken away from them, feel free to visit a post that I made this morning around the psychology of those people. Narcissists, Machiavellism, sociopaths. Take a trip down the psychology path for a little bit and just get inside their heads and maybe try and work out how you can help them have a paradigm shift, because that is what it's going to take for people who are into that QAnon thing, deep state, all that stuff that we've been talking about, those COVIDiots. They need their own paradigm shift. So anything we try and throw at them and make Facebook posts about or retaliate with comments, none of that's going to help. Someone suggested, Pete Natali actually suggested that we make some YouTube style videos on why they're wrong. Maybe that will help. Maybe I should start uploading these videos more regularly onto YouTube. I'll get back to that. Okay, but while we're all here, we're here to find out info about the Oxford vaccine. So, one of the big things that's popped up in social media, that's where we all live now, is that it's being rushed, that it hasn't been proven to be safe, and that no one wants to be given a vaccine or feel like they're being forced to take a vaccine that has been rushed and proven to be unsafe. Okay, totally. I don't want to take a vaccine that has been unproven and that's unsafe. No way would I take a vaccine that hasn't gone through the proper measures to the World Health Organization standards and the TGA standards here in Australia. I feel protected by the TGA. I wouldn't go so far as to say I feel protected by the WHO, because I don't know the ins and outs of those regulations. But I feel protected by the TGA here in Australia. And I want to help you understand why those comments are coming out. So the FDA, which is the Australian equivalent of the TGA, are a body that are in charge of, these bodies are in charge of regulating the drugs that go onto the market. And the people that are within these institutions are medical professionals, scientists, and people that know a lot about the human body, medication, and how we respond to things. And Trump has come out earlier in the month and said that he is in negotiations with the Oxford vaccine to rush it through the FDA, because he feels that the FDA is essentially using politics to block the vaccine from coming to market before he is re-elected. Kind of, if you can just think about all of that big picture, the FDA is stopping the vaccine going to market. So Trump is going around the FDA to try and provide some outlet for the Oxford to rush the vaccine through the FDA approval. Well, the company that's making the vaccine and Oxford University have both come out and said that they are not in negotiations with Trump and that there has been no discussions. So by him saying those comments in the public space, he's created doubt around the vaccine process. And the TGA and the FDA do not want the public to lose trust in the vaccine process. There is already enough mistrust. There is absolutely no way that any of these bodies will be pressured by politics to rush through a vaccine that is unsafe and untested. And the heads of the FDA and all of the bodies, or the people within those bodies, have all said that if Trump tries to rush through a vaccine to the American market, they will step down from their positions. That's how strongly they feel about this. And the FDA and the TGA are both up there with their moral compasses. I know a lot of people have mistrust in vaccines, but I just want to let you know that these bodies are, they're filled with scientists and people with medical knowledge, and they cannot be pressured just because it's a pandemic. Nobody wants the public to lose trust in vaccines, and by pushing these ideas of pushing vaccines through is definitely not something that scientists are on about. Okay, so what is the Oxford vaccine? Okay, so the University of Oxford, a group of scientists have developed this vaccine, and they are working in partnership with a company called AstraZeneca, AstraZeneca. They have the agreement to manufacture the vaccine. So it's based on this this project that came out of the University of Oxford, and it is basically a chimpanzee virus. Okay, it's called an adenovirus that is naturally part of the chimpanzee kind of disease infection cycles, and we use this particular virus as like a carrier. So, like, this is the virus, right? The empty virus of the chimpanzee. And they put inside it just the spike protein of the coronavirus. Then they use the chimpanzee virus to get inside our cells. And then they give our cells like the spike of the coronavirus. And then our bodies make up lots and lots of the spike virus, or the spike part of the virus. And then our body develops immunity or antibodies against that spiky part. And we've had many conversations about the the kind of the structure of the virus, but basically the spiky bits on the outside are the bits that bind to our human cells and use it as entry to get in. So if we develop antibodies against the spiky bit, then if we ever come across it, theoretically, we should be able to protect ourselves from that virus. So I'll give you a few stats from a paper I read this afternoon. Oh, it's a publication on The Conversation. So this was put together by Katie Louise Flanagan and Magdalena Plablansky. Okay, so just some facts here for you. It hasn't been tested in the most vulnerable groups of our community. It's been tested in young, healthy individuals so far, and it's shown to have no toxicity, no adverse health effects, and it has been shown to have stimulating immune responses around the antibody production and the T cells, which are the ones that can come along and destroy cells that are manufacturing the virus particles. So that's how this vaccine is so far along, because it's been able to show these immunogenic kind of markers to get it to the stage 3. So stage 3 is expanding to lots and like thousands of people. It's rolling out in Melbourne, it's rolling out in Geelong. Then it's kind of a waiting game to see what the natural exposure is to these communities and to see whether it's protective. So the trial is like stage 3, they get the dose of the vaccine, and then as people go about living their lives, they then follow up with these people to determine whether they have then been have contracted the virus and whether they've got over it. So there's no way, they don't actually infect the people, they don't expose anyone to coronavirus. It's like a natural thing that has to happen, and that's why we have to wait until the end of the year to have any results from this. And if we get to the end of the year and we get these clinical results back and we can see there may be some protection in the community, I want to talk about what would happen for Australia. So at the moment, the Australian government has signed a letter of intent with the pharmaceutical company that has the license to manufacture this vaccine. So we don't have to go down, we don't have to produce this vaccine if the results aren't favourable, if the results don't pass the stage 3 trial. So we're not putting all our eggs in one basket. There is 160 plus vaccines being sort of trialed at the moment that are in those early phase trials that can push out and maybe be ready for stage 3 before the end of the year. So this is just one of the options. There is going to be many, many more options negotiated with the government before the end of the year. You'll see in the next couple of months there'll be more and more vaccines that will pop up that we go into these letters of intent and agreement around. And I just want for everyone to understand that this isn't the golden bullet, like this isn't the silver bullet, sorry. This may or may not work, we don't know. And we certainly won't be putting all of our vaccine eggs in one basket. Just going to have a little bit of wine with the cho. Okay, so at the end of the year, if the stage 3 trials show that people were able to be protected, and in the increased group, which will have some elderly people, if they were then shown to have no adverse side effects, then the letter of intent agreements come in. And what happens is that Australia essentially buys the license from this pharmaceutical company and gets kind of the recipe to manufacture this vaccine in Australia. So if it doesn't pass the phase 3, obviously we don't get the license agreement, we don't manufacture. If it does pass phase 3, it then will go on to CSL, and which is a company, the Commonwealth Serum Laboratories is the historical name. It's actually an independent, like a private company, and CSL have the contracts agreements because they have the capacity to manufacture. Becton and Dixon is another company that's on board with this agreement of the letter intent that if we do go through, that they'll be supplying like the needles and the vials and all the kind of consumables that will go around, manufacturing the vaccine. I also wanted to point out that Norman Swan on his Corona podcast highlighted that normally vaccines are stabilized at fridge temperature, so 2 to 4 degrees. And at the moment, this Oxford vaccine is only stable at minus 70 degrees. So we still have a long way to go in upscaling the manufacturing process and passing those phase 3 trials. There's still a long way to go with the vaccine that seems to be, potentially the savior, and everyone's talking about it. A long way to go. Okay, see what other notes that I pulled out of this. Okay, so this vaccine is already in a fairly substantial phase 3 trial in Brazil. So we're still awaiting the trial results from that. And it's also gone into trials in the UK and India. So not only will it be phase 3 trials here, there's other phase 3 trials around the world with the same vaccine. So we'll have a lot of data to pull on, hopefully by the end of the year. Okay. Okay, other vaccines that we have closer to shore. Now, the University of Queensland is developing a vaccine, so we may go into agreements around that one as well. We'll see how some of those trials turn out. We've spoken about that vaccine a couple of times. Okay, cool. I'm going to babbled on for quite a bit. Minus 70, blah, 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 Trump. Yep. Okay, we covered all that. Oh, Queensland, I'll get back to you and your advice around masks. You've all been okay, we'll just get to it now. Queensland, if you're in Queensland and you're tuning in, I think it was this morning, your Premier announced that if you are moving into a space where you can't maintain physical distancing, just like it was for Victoria, it's advised to have a mask now. So bear that in mind, kind of have it to your front of mind. I know it's hard, the psychology of being the only one wearing a mask, but trust me, you will feel so safe when you're out there. And if you don't know the levels of community transmission, especially around Brisbane, it's not a bad idea to start wearing a face covering. If you don't have a face mask, a scarf, something like that is fine, as long as it's at least 2 layers. Okay, I'm gonna see if there's any questions, and then I'm gonna talk about some additional mask stuff. Okay, lots of questions here. Okay, evening. Dad. Okay. I was hoping you were going to discuss this new infection with a different strain. Yeah, super interesting. So what comes to mind about this South Korean man that was infected was that his initial infection, his primary infection, didn't develop antibodies and a T-cell response that was able to be called upon in his memory cells. So, when we're first infected with a new bacteria, virus, we develop a few different phases of our immune response. And one of those responses towards the latter phases is when we develop these antibodies, our cells actually keep like a memory card of that. And if we ever see the virus again, it like just pulls out the memory card and it like sticks it in the mainframe and it's like, remember when we saw this? Everyone swing into action, and all that would happen before you even realize that you're infected. So I don't know how severe his second infection was. I don't know how severe his first infection was, or whether he had an antibody response. So we'll get more info. I just know that they have spoken about this like breaking news tonight, but we'll do some more on that. I'll find out something for you. So hope that helps you, Jin. Exactly, who cares? The rest of the country already has it. Freedom? Yeah, you take my freedom. I don't care. Celeste O'Keefe, the COVID idiots sit across the bench. Across the bench. What bench? Write to your local member. I have. What are we talking about? Are you guys having a conversation in there I don't know about? G'day. Hi, Kelly. How are you? Did your 10th lot of face masks arrive? I hope so. I packed those 2 orders that you put in on that same day together, just FYI. Red, White, and Dean Rodemer. Oh, yeah. Dean Rodemer is this one. He's also done me did my sister and I these 2 beautiful little twin birdie things. Okay. Trump equals totalitarianism. History would suggest that situations like this never end well. Yep, exactly, Louisa. Ever, never, getcha. Okay, questions. Have you heard that some religious leaders have expressed they won't support a vaccine as it has cells from aborted fetuses? Is this true? Yes. So we've done a topic on this before, and the aborted fetuses cells, I'm going to get the name of the cells so I can talk about it properly. Aborted fetuses cells. It was a donation. It was donated cells, and the cells became part of the original manufacture of some parts of the virus pipeline. And because it was an aborted fetus, some religious groups don't feel that it is ethical for them to take this particular vaccine. And I understand that from their religious point of view. And these types of vaccines, there is ethical dilemmas for some community groups. And unfortunately, these are the kinds of vaccines that will come out first. It's not always going to be this way, but different types of vaccines will come eventually. If this one's not for you due to religious reasons, I would encourage others, even though it's against your religion, to take it if they can, because that provides you with herd immunity. Okay. But yeah, that's a thing. I'm used to be religious, family, but I mean, I'm sorry for those people that this impacts that way. Questions. Oh, I'm getting more things. Okay, where did I get up to? Okay, yeah, I did think. Yeah, I read this today. Yes, his original cell from the 1970s. Yeah, Vicky Tennant, there you go. What happened to the Flinders Univax? Oh, I'll look it up. There's lots. There's 160 vaccines in production, like in the research world through different phases of the trials. So there is going to be way more that pop up. Tessa, yes and no. It does use material from cell line that was derived from a fetus decades ago. It was not continuously used. It was a not continuously used fetuses. Yeah, it does not continuously use fetuses. Yes, that's what I mean. It's like a cell line that came from a donated tissue. Okay. Replying to. Oh, you're all replying to each other. Amazing. Hey, Sarah, how are you? Sarah cut my hair. Thank you, Sarah. I wish you could come over and style it for me every day. Sarah Stevens, that is. Surf Coast Hair and Makeup, if anyone wants her. Okay, I wore a mask today shopping. Quite a few wearing them. Don't get any funny looks at all. Oh, Shauna, where are you? Vicky Tennant, you're replying. Okay, Angeli, the Russian vaccine is based on the 2 human adenovirus vectors, 85 and 8026, whereas the Oxford vaccine uses the chimp vector 80AOX. Yes, they're both adenoviruses though. What are your thoughts on the efficacy and safety of the Russian vaccine compared to the Oxford vaccine? Okay, so the Oxford vaccine and the Russian vaccine use exactly the same technology. What we don't know about the Russian vaccine is anything to do with the impacts of a phase 3 trial. And without that phase 3 trial, we can't have the boxes ticked for it to be approved from TGA, FDA, World Health Organization. Hopefully some other country takes that vaccine and does a phase 3 clinical trial on it, because it may be an amazing vaccine. We don't know because we don't have any information on the safety of this vaccine. So yeah, Oxford vaccine and Russian vaccine, the same technologies in terms that it's a live vaccine, like a live virus vaccine, using the adenovirus. But yeah, we don't have enough info. So I wish we knew more, Angeli, and I can't wait for another country to take that vaccine and do a phase 3 clinical trial on it so we can see if it is if it's safe for us to use or not. So I guess we won't even know from Russia, because I believe if you don't take the vaccine, you big trouble. So we'll see. See, we're not Russia, people. Okay, the crossbench of Parliament, especially in the upper house. Oh, I wish I knew more about Parliament. That's why I can't say much about the state of emergency extension orders. I can see both sides of the story, but if you're telling me one is going to provide extra health benefits to the state, I'm going to go with that one. Okay, David, Zafina, how's your face masks going on? David, we need to get you on the show to talk about some different Aboriginal culture and some more of our history. When we take a breath, okay? Okay, you are a wealth of knowledge, Fadi. Love your expert opinion. By the way, good news. We were able to raise $5,000 for our local Indigenous community to support disadvantaged Indigenous youth through the face masks. Yes, David, that's awesome. I'd love to hear about and see what they're doing with the funds. I'm sure you guys will make something cool about that. Actually, Springfield, where yesterday's case here in Brisbane. Oh, Shauna, didn't I send you some masks in Springfield? I remember writing that one. I got tested yesterday and I got a negative result. Awesome. Okay, guys. Well, I think there's a lot of dribble and a lot of my jolty facts in there. So hope you enjoyed. I hope it cleared things up a little bit. You will see more vaccine agreements of intent and letters of intent come out. Oh, this is what I did want to point out this. Now, Jess Milroy, who is from Inside Out Natural Health Medicine, she is the wife of a friend I used to train CrossFit with, Ben. She posted this about the pharmaceutical company that has the license to manufacture the Oxford vaccine. I just want to point out a couple of things that she said. Now, she says, check out the amount of penalties this company has copped. By the way, this is the vaccine company that the Australian government has chosen to make the COVID-19 vaccine. Surely there are more integrous companies to choose from that haven't had penalty history of $1.4 billion. Okay, so AstraZeneca, that company, they're based in the UK, pharmaceutical company, and we've all discussed how we're not sure pharmaceutical companies, they're all in it to make money. Like, they want to help people, but they're here to make money. Okay, so here's some of the top 5 offences that they've had in their industry. Healthcare-related offences, like 194,000, 4 of them. Government contracting-related offences, 12 of them, totaling 583 million. Competition-related offences, okay, yes, had some of them. Consumer protection-related offences, 5 million. And employment-related offences, a couple of them. Primary offence types, off-label and unapproved promotion of medical products. False Claims Act and related. Kickbacks and bribery. Okay, well, they're not working with Trump, so that's one good thing. Maybe they've learnt their lesson. Consumer protection violation offences and employment discrimination. So, like, we've signed a letter of intent with these guys. Thank you, Jess, for posting that on your story. Took a screenshot and printed it out. It's always good to know everything and know who we're getting into bed with. So we've signed a letter of intent, and there's going to be plenty more of those letters of intent to come out. So, yeah. Emma Jane Stevens, what? Yeah, I mean, don't be surprised by anything that goes on in these pharmaceutical companies, okay? We'll keep an eye on them. Don't you worry about it. And we'll see you on Tuesday. And, face mask things. Okay, right. Queensland, get ready. You're on. Okay, it's your time. Okay, obviously I'm making them. Face masks. You're going to need a fair few. Here's one of my personal favourites. Got kind of like my doggo on there. Cute. You're going to need a few because every time you go out of the house is a new day. I've been running in mine as well because I'm a psychopath. But these cotton masks that we've been making, now you can put a hole in these, right? If you're going to, I don't go out I go out once a day for a run, that's it. But if I went to work all day and I wore this all day, it would get soaked, okay? With your breath, all the breathing, okay? So what you want to do is you can make a little incision you want to make a little incision. And this is for any cotton mask that you have. Okay. You're going to make a little incision in the side of your cotton mask. Okay. And then you're going to get one of several things. You're either going to go onto the Fartifacts website and get yourself one of these PM 2.5 carbon filters. Now, this has enough, this is like 5 layers and it has an activated charcoal layer in it. This filter, oh, there's 2 in there. Oh, there's 2 per packet. Ooh, bonus. Okay, so you're going to get one of these filters with clean hands, obviously, and you're going to put it inside your face mask. Still 75 of you here watching me, so I'm happy with that. Okay, once it goes inside your face mask, all right, put the filter, kind of set it to the middle. That's going to make this mask last for 5 days. You're going to be very careful when you're putting it on and off that you're not touching the outside. But basically, that single-use mask that you have now is going to last you 5 days. So you can keep it in the car, go to work, all that. But basically, this has now got my 2 layers of cotton, and it's got the extra 5 layers of the filter, and it has activated carbon inside it. So provides extra layers of filtration, and that's especially important if you have to wear that mask all day. So if you're a mouth breather like the rest of us, it's going to get nice and wet inside there, so you're going to have to want some of these filters. There's plenty on there, so there's enough for everyone who's bought masks, and yeah, go for it. Or if you can't find one of those filters, I'm here. Okay, if you can't find a filter, or you don't want to buy the filters, I'm just selling them in packs of 10. If you can't find a filter, this is a percolator coffee filter. Okay, you can fold it in half and do exactly the same thing. Put that little snip in the side of your... Guys, where did I put it? Someone comment. Where did I put it? Oh, I put it on my desk face mask hook. Okay. So same thing. Got that little hole in the side, and you can put your little coffee filter in there, and that will make it your extra layering. If you can't find the coffee filter, if you can't find a coffee filter, or if you don't have any of these left, you can take a reusable one of these nurses masks, okay? You take that mask, and this is a single-use mask. If you put it inside this, it can last for 5 days. So same again, you have that little snip in the side, and you push. Now this has got like 3 filters in it. You push that disposable single-use mask, and you use it as an extra layer inside your cotton mask, and that's now going to last you 5 days of kind of just normal use, not heavy breathing. But if you feel that if you have a look and that filter is getting wet, it's time to change it. So you take all the filters out, throw them out properly, wash your hands, and then this goes in the wash. Okay. These are easy to wash in the washing machine. Okay, we've been a long time. So have a good night, everybody, and I will catch you next Tuesday. And in between, I'll find out some more facts on the Korean guys. Okay, I'm trying to use my mouse to finish this on my iPad, which is not going to work. Bye.